So, welcome everyone. Today is Monday, January 31st, 2022. I welcome you to explore careers in healthcare. Uh, this session, we talk about CNA training programs. Many of you on the call know that there was a large announcement on January 1st about offering free training to people who are interested in getting their CNA certification. So we have got a couple of people on the line going to talk about that. And also we're going to hear what it looks like to receive CNA training when you're facility based, when you're at a location, and how you can take advantage of the many facilities that offer this type of training. I do want to assure you that even though today is January 31st, resources for helping you or helping a friend or family member research careers in healthcare remain online at careerforcemn.com/healthcare. All of these recorded conversations too are on careerforcemn.com's Explore Careers in Healthcare webpage. We've been both posting them to YouTube and then linking them, forming chapters with all of our fantastic speakers. This month we've heard a number of superhero stories where speakers talk about why they stay, how they got into healthcare, and why it's important to them as a career and why you should consider it too. So we've split up all of these so that you can really watch shorter segments. You don't have to watch a 45-minute long recording. Another resource going forward on CareerForce MN is that we now have a training program finder. And any training program in the state of Minnesota that receives state or federal funds, and thus the training program is free to you, the job seeker, is eligible to be posted. So we continue to post more as we find out about them throughout the state. And so you can go to careerforcemn.com/training-programs and look to find a program that's starting in your area. Not only are these healthcare training programs, but as you see on the screen, there's an OSHA 30 program that started today, a Welding Discovery Day, a CompTIA Network Plus IT training program, and paid pre-apprenticeship training programs, among others. There are more on there than these. So please, always, if you're a job seeker, if you know someone who's looking for some training and they might fit the criteria for being eligible for this program, please let them know about this. The speakers that we have here today, as I mentioned earlier, are from Minnesota State System. Caring Careers Start Here, which is a collaboration between Minnesota State's Health Force, Leading Age of Minnesota, Care Providers of Minnesota. We also have a speaker from Jones Harrison Senior Living who's going to tell us about excuse me, about what it looks like for a CNA training program in-house with them. And also we have someone from Century College who leads one of the CNA training programs at their facility, and going through all of the nitty-gritty details of attendance, what to expect, how many hours, how much homework, etc. So first up, I'd like to welcome Valerie DeFore from Caring Careers Start Here. She's going to give us an overview of the Next Generation Nursing Assistant Initiative. Welcome, Valerie.
Thank you. I'm happy to be here. I'm happy to talk to people who are interested in possibly being a healthcare hero, because we sure do need you and others like you. Oh, I've got a little bit of the reverb going on, but I'll just keep talking away. Yeah, so we're super excited that here in Minnesota we had a special initiative launch back at the beginning of January, and the initiative was really about getting 1,000 new nursing assistants trained and employed in our state by today. Actually, it was our goal. To do that, we secured some funds to offer free nursing assistant training, and we did that by opening up classes across our state that were called Next Generation Nursing Assistant classes. So all of those classes are offered for free, and it covers not only the cost of the class, but also provides for a set of scrubs and materials like a textbook or skills packets, as well as the certification exam. So we really wanted to make becoming a nursing assistant, as barrier-free as we could, and that starts with when you first need to enroll for a class. A lot of our classes are winding down, but we are posting a few still this week. So I encourage you to do two things. One would be to go to the website you see in front of you, caringcareerstarthere.com, and you'll see on that webpage in the middle, you can click on what does it say exactly? Sorry, I thought I had this open. You will click on the middle, it says Nursing Assistant Training. And if you click there, you'll be able to fill out a survey form, and that just sort of gives me your contact information. And then you'll be able, you'll get a link back from me with where you can look to see if there are free classes available. You can also access that the same way, and you can also learn more about this initiative if you go to the website, the second website on this page, which is www.ohe.state.mn.us/CNA training. That gives you information about this entire effort that is underway. I will say that we've had lots of Minnesotans come forward and are interested in becoming nursing assistants, and we want to make that happen for anyone that is interested. So even if you discover that maybe our free classes through this initiative aren't near you or don't work for you, I really encourage you to check back in with Career Force. They can probably help you. Maybe they can help you find a class that works better. And then I also advise people, you could also just check with your local care center and see what they might have to suggest for you if you're interested in being a nursing assistant. I started my career, well, not really my career. I didn't know it was going to be my career. I started in college as a nursing assistant, and I have to say it was one of the most fulfilling roles I've ever held. And it really did start me down a path, that led me to where to the career that I've had. So even if you maybe think you're interested in a health career, but you don't maybe know what that is, nursing assistant's a great place to start. You'll learn a lot about yourself and about caring for people, and it will make you a better anything down the road. So I think, Liz, that's kind of the high level of the Next Generation initiative. I'm happy to answer any questions or expand on anything that I glossed over too quickly.
Give us an idea of how many people have registered in the past 30 days.
Yes. So we have, this is a moving target. We probably have about 700 plus people that have already started, or some are completing their nursing assistant training under this initiative. We have waiting lists at some of our campuses to, people want more classes. And I've heard from about 1,200 people in general through that Caring Careers Start Here website that they're interested in learning more about this. So the response from Minnesotans has been amazing. I think the ability to do the training at no cost is a real key factor. and I think people are understanding the honor and the importance of this role, and kind of really looking, wanting to make a difference. And um, I can just tell you that there's probably no other occupation where you will make a bigger difference in the lives of people. So if that's interesting to you, you're looking in the right place for nursing assistants.
Yeah, the numbers are fantastic. Even a couple of years ago, a friend of mine's daughter, she was a college student or just out of high school. She was 18. She decided to get her CNA and worked over the summer. And then as she went to college, worked for a local area um, facility part-time. So that
Mhm.
was her college job. And so it has space for anyone in there, either beginning or um, older or, whatever the situation is.
Yes, and I saw in the chat box a question about the wages, and I know we have employers on here that could probably, answer that more directly or specifically, but um, the hourly salaries for nursing assistants over the last year have increased, and I think probably anywhere from 15 to 20 dollars an hour is probably the ballpark that we're in right now. So that's been a good shift upward from what you might have thought those wages were.
Hmm. Absolutely.
Um, Someone else asked, how would you contrast the role of a CNA from a direct support professional?
Oh, well, I can take a stab at that. I have not been a direct support professional, but I also work with that occupation in my current job. Um, I think there is a lot of similarities. The difference really is um, if you're a direct support professional, you are more likely working in a group home or individually with someone who has a disability or disabilities that you would be helping, supporting them. Um, the level of care is probably less. The acuity might be less in working as a DSP, although that might not even be true because you might be working with someone maybe who's confined to a wheelchair or paraplegic on feeding tubes and things. So it could really vary, I guess. Um, I don't know. That's my perspective. I think most nursing assistants are, I typically think they're employed usually in skilled nursing facilities, assisted living, whereas DSPs are often more frequently caring for people in homes or group homes. Oh,
Good.
good. There's some folks helping me out in the chat box, so I
Yeah.
appreciate that.
Great. Thank you. Um, I appreciate having this overview, Valerie, of everything that's going on. I posted the link to caringcareerstarthere.com in the chat. So any of you on the call, please go to that, click on the link, and Valerie will respond to you with information, whatever you need, and with the upcoming schedule. We're now going to move ahead and hear what the nursing assistant training program really is. We're going to hear from Lynette Lancourt from Century College, and she's going to tell us everything we want to know. So welcome.
Hi, thank you. I apologize I came in late. I was at a different meeting. I'm just wondering, Liz, how will you advance the slides that I'm going to be talking off from?
Just say next and I'll do it.
Okay, can you next? So what I did is I tried to give everyone a really transparent overview. There can be details that will change from campus to campus, little things. So this is an overview. Next, please. So program description, this is a certificate-based program that is 76 hours, and we're using the Minnesota Department of Health curriculum, and eligible candidates who complete the class are able to sit for the nursing assistant registry, and when they pass that, then they appear on the registry. A couple of things that are going on right now. Due to COVID, there is a waiver right now that nursing assistant trained staff can be working without having to take the certification exam. So normally it's 4 months that you can work without that certification. Right now, it's been opened up for over a year due to COVID. Next, please. So the program requirements, some campuses have prerequisites where you may have to take AccuPlacer or a reading level test. So this is one of the examples where I'm saying it might change a little bit depending on the campus that you select. Otherwise, there are no prerequisites other than you must be 16 years of age. You must be able to pass a background study. And upon passing that, you'll be asked to fingerprint for an additional $12. And then courses range between $850 and a little over $900. And that's what the Minnesota State campus is. And then you're required to purchase a packet for $20. Does anyone have any questions at that point or anything from there?
No, nothing so far.
Okay, next slide. So when you ask about how long does it take, this is a 76-hour curriculum, but each campus may deliver that a little bit differently. We might do 12 or 10 8-hour days here on campus, and you could get it done in a little over 2 weeks. Or if somebody delivers it hybrid, they might be doing meeting on campus 2 days a week and expecting so many hours of online coursework during the week while you're doing it hybrid. So there's different ways of fulfilling it. But if you are a workforce member and you're looking for opportunities for your clients, do know that you should check the website and look for the different campuses, because there's so many different ways that it's delivered right now that there has to be a class somewhere that would meet somebody's schedules. They're not limited to 8 to 4 every day. They're over weekends, they're at night, they're during the day. So there's lots of different ways to do it. Let's see. The cost, if the governor is saying he wants to recruit so many, where's the support? That's the question. What support are we referring to? Money. Well, they've given us a tremendous amount of money to offer free classes to all of these folks to get training. I don't know, Val, do you want to speak to that?
Yeah, I guess that's where I was headed with this. We did receive funding from the governor secured funding through the American Recovery Plan dollars for the Next Generation Nursing Assistant Initiative, which is the 1,000 goal of, with free training. And I know that there has been other funding made available to care centers for, recruitment and retention and whatnot. So I guess that's what I know about that part.
Okay, so then now I'm reading in the comments another thing. So there's a question, but we're saying, hey, a class costs $800 to $900. So Val is here talking about that the governor has made these classes free to everybody right now through the initiative that Val is talking about. But let's say that wasn't available. If you become a nursing assistant, you will be reimbursed when you get your first job. And the state does reimburse you for that class. So there's a couple of different things that happen there. When you take the nursing assistant class, the curriculum requires that the instructor tell you about the reimbursement for both the class and the testing. So you will be informed of that. In addition to that, I'm seeing it in the chat here. It is true. Some of the long-term care properties will train their own staff. Now, if they train you, you can still sit for the certification exam and you are still taking a certificate-based class. They have to be licensed by the state to provide that class to you. So you would not be reimbursed for that because you're no money out of pocket. Your employer's providing it. But if you're taking the class and then seeking employment and you paid for the class, you will be reimbursed for it. I hope I didn't make that too confusing. Next slide. Okay, so here's how a class breaks down. It's basically 76 hours. So you would do 60 classroom, and that could be anything, including when you're talking about hybrid. That's lecture, that's some skills demonstrations, and that's chapter quizzes. Now there's a quiz at the end of every chapter. Candidates have to successfully achieve 75% on each of those quizzes in order to progress to the clinical portion, which is the last 16 hours. Now, the 16 hours of clinical always took place in long-term care, hands-on, working with residents. Due to COVID, that has pivoted and now is supervised practical training, which is actually additional hands-on skills training in the lab with your instructor. And if you did this hybrid, same thing. You're going to be doing 76 hours. Some programs may be a little bit longer. None will be any shorter than that. And you would still do some classroom demonstration, skills, 7 or 60 hours of that, and then 16 hours hands-on practical training. Next slide. Okay, and I just wanted to leave some time for questions, and I see that there's a lot going on in the chat. Where did we leave off? You can guide you through. So people have to pay themselves. Well, yes, you could. You have two options in that case. You could find a class with a Minn-State campus, or you could go to a long-term care and interview and ask if they would do the training for you. So it's either or. Let's see. What is meant by next generation? That was a name that we gave the initiative that Val DeFore and her team at Health Force are working on. We gave that name to the next group of nursing assistants that were being trained free of charge by the governor. The first round we got in November, and that was all of the National Guard folks. And then after they were all trained to start getting into the long-term care and start helping out, we had our next generation, and that was all the folks that are coming to us through this grant. So I hope that answers the question. The only other thing I would say is, I know this is confusing. I do this every day. If there is anything that you have for questions, please reach out. My phone number, my email are on this slide. I'd be happy to direct you to a campus or a program or help you find the information you're looking for. It seems easy if you touch it every day. It's not if you're just trying to navigate all these websites and figure it out.
You know, if I could add too about the funding. Hold on, I'm trying to figure out the echo. About the funding, you know, a job seeker may contact a career force location nearest them and ask to be evaluated whether they qualify for dislocated worker funds. Because I know oftentimes in the past, dislocated worker funds have been applied to training programs. So this could be an opportunity as well.
Mm-hmm. I'm looking at Val's comment in here about all are welcome. Yes, but you must be 16 years of age and older. Does anyone have any questions about the certification exam for nursing assistant?
Is it done on paper or computerized?
Well, so I didn't know if we had trainers or candidates online right now. So right now, the state of Minnesota is in a blackout period and is not currently offering the certification exam because they are changing vendors. We are moving from one vendor to a new one. And so there's been a lot of questions. Are you testing? When will you be testing? And so I wanted to make myself available to just answer any questions on that. I would say you're going to start seeing the campuses who right now are the only ones that can legally do the certification exam delivery. The campuses all over the state are going to start to soft roll out this month. You'll start seeing the exams coming up slowly. Check the websites, call the registration offices, and they can tell you when that's supposed to start happening again on their campus.
Good. Thank you, Lynette, for all of
Sure,
this
thank you.
information. Is there anything else you want to add?
I think I glazed over one of those slides where there was a link to the RST website to find where all the classes were. If you could back up one maybe or two. There we go. That green link right there, that's the main link to all the nursing assistant classes and all the campuses statewide. You can search it by nursing assistant and find all of them.
Good. Thank you. So, MnState is a fantastic program, and they're all over the state of Minnesota. There's another option, though, when you want to get CNA training, and that's contacting a local long-term care facility and asking their HR staff if you accept a job, whether they will help put you through training or provide that. There are different models of how that works. And so it's important to be upfront and discuss that. So here we have with us Annette Greeley of Jones Harrison Senior Living. And she's going to tell us how Jones Harrison supports CNA training and its staff through ongoing training programs. Welcome, Annette.
Hello, thanks for having me. I'm always happy to try and promote an awesome career field. And so I feel that I'm actually representing more than just Jones Harrison. I'm going to represent all the nursing homes and long-term care providers in the state of Minnesota. And you've got some great resources here with the other two, with the MnSCU and the state deed program. And I would tell you there are many ways to get into long-term care and get it paid for. So the governor does have that program where they are helping to pay those costs. You have deed that has the multiple programs that they can use to help pay for those costs. And then you have the nursing homes and assisted livings. Not all, you will have to check on that. Each one's a little different, but we can also pay and provide training. So at our organization, we work with outside organizations to do clinicals. So you would be doing your classwork, part of it online, part of it in person. But when you actually have to come and do your clinical time or actually learning in practice, that would be at our site or a number of other sites, all nursing home, not all, most nursing homes that work with CNA classes will also offer the clinical site. And so nursing homes really want to help people. We know there's barriers. The classes, yes, are expensive. And so a lot of nursing homes will actually pay your upfront costs. Or if you've already taken that class, you can bring your receipts in and we can reimburse you for that. And I think that's the nice thing people should know about nursing homes and like I said, some assisted livings is that we can help with that, or we can help you get connected to the workforce center or any other program that can help you get funding to do these classes. And I would say too, if you're kind of thinking about being a nursing assistant, but you're not quite sure, we see a lot of people maybe start in our dietary department, kind of see how it works, how it feels, get to know some of the nursing assistants, see if it's for them. And then they will come to us and say, I would like to become a nursing assistant. And so then we will work with them to get set up with that training, pay for that training so they can stay with us and continue in a career movement. I have known many nurses, RN, LPNs who started in dietary, became a nursing assistant, then maybe became a trained medication aide, what we call TMA, and then have continued to move on. So that's the one thing I like to help promote is that there's a lot of opportunities. And so on our slide here, you can see, we focus on more than just nursing. You can start as a nursing assistant, but there's a lot of different areas you can go into, such as social work or IT or maintenance. And we can help with all that pathways. Nursing homes in the state of Minnesota can assist with tuition. And so that's an opportunity we really want to work to promote. And I would say a lot have strong relationships with their local community education, the colleges. So we have connections if people are interested. I would also say that the CNA training now, we started to move online, and that is a lot more family friendly. So if you've got kids and a busy lifestyle, you can do most of that CNA program online and just do smaller parts of it in person. And like I said, there are some nursing homes that do offer that training right on site, or they will work with a community, a tech school that offers that and help people get trained. You can go to the next slide. And I want to tell you, there are a lot of resources to get into healthcare. And I put on the deed, the workforce centers, the community and technical colleges are great partners. Leading age and care providers are trade associations, so they represent companies that help serve seniors. They offer scholarships too. So if you came to work for a nursing home or an assisted living, they once a year will put out applications for tuition assistance. I mean, there's a lot out there. There's actually also, if you start your career as a CNA and want to move on into nursing, the Minnesota Department of Health actually has a program to help repay loans. So I just love that we're talking about this and these programs. The governor's initiative is fantastic, and the work that Deed and Val is doing with the health force and with the state system, there's a lot of opportunity, and I think we're all here to help people kind of see what a great industry it is to work with seniors. My story is I actually started out as a nursing assistant in a small rural town in Minnesota, and loved working with the seniors so much. And I ended up going to school and working with seniors since I've been out of college. Like I said, I started as a CNA, and then I did kind of social work stuff for some senior housing, and then I decided to get into management. And so then I went back to school, and I got my nursing home administrator's license, and I worked in assisted living and memory care and nursing homes for a long time. And now I'm the president and CEO for Jones Harrison Residence in Minneapolis. So I can tell you now that there's a wonderful path in our industry of long-term care. Steve has a question about dietary aids. Those can range depending on where you live, but in the metro area, that's around in the 15 plus area there for dietary aids. If you're in different parts of Minnesota, you might see different wage scales for that. And kind of what a dietary aid does is they help work in the kitchen, help make sure the food gets served, talk to the residents, serve the residents, kind of help clean up in the dining area. It's a great way to get to know residents and fall in love. And like I said, a lot of kids aren't very comfortable, or even adults, with being a CNA. They're not quite sure how that works, and so this is a great avenue to kind of see what it's like and watch CNAs and kind of determine if you think that's for yourself. The other pathway too, once you get your CNA, could be being a trained medication aid, which is like doing another step up. And those avenues are all part of even, the workforce centers, and then the community technical colleges offer that path. And I think, what's my next slide? I got one more, and that was mine. I think from the standpoint of the provider, we work in partnership, and like I said, and then there are facilities that can actually offer the training themselves on site. So there's different varieties for getting into CNA, but right now is a fantastic time to do it with the governor's initiative, with the programs that Deed and the Workforce Center have, the outreach that we have with our technical and community colleges. and the nursing homes. It's actually a great partnership now and a fantastic time to get support to look at a great career field.
Annette, there was a question about dietary aid salary or hourly rate. I figure you might be better at answering that than I
Yeah,
am.
yeah. And I said that's kind of based on where you live. If you were in the Twin Cities area, you're going to see a dietary aid
Oh, sure.
range around the $15. I think if you're in more outer Minnesota, rural Minnesota, you might see that vary a little bit too, a little bit less maybe, and going up. But for us and a lot of facilities in the Twin Cities, it's starting in the $15 range and goes up.
So, how would you coach a job seeker? Say they did want to become a CNA and they were trying to decide what to do. Maybe they live near Jones Harrison. And so would they just send an email to, like their local facility HR and say, hey, can we set up a time to talk? I'm kind of interested. Or should they just fill out an application online wherever, whatever facility they've chosen? How would they go about asking those questions?
Honestly, there's different ways you could absolutely email, send an email on all of us have websites. You can all go to any nursing home, assisted living's website, and you're going to see a career link, and you can send in an application there and get information to have someone contact you. You can then also just walk in. We have a lot of people that just walk in and someone will come talk to you about career opportunities. And the other one is you can always call by phone too. So you can call us, email us, walk in. You can even text us because I know a lot of people like in certain generations, they're texters. And we actually have our HR person has their own phone and she communicates a lot with interested parties through texting.
So it's an encouragement to any job seeker. Reach out in whatever mode of communication works for you
yeah,
and
yeah, and
just
we've
start that
been to
conversation.
yeah, and we've been to there because we know there's certain age groups that prefer texting over calling on a phone.
Yep. Yep. Um, One question coming in as a CNA, is there a specific skill set that you would need to have?
Honestly, I'm going to say have a big heart. To me, loving, caring for people, and having a mission, servant type heart is number one. I can teach you how to brush teeth and I can teach you how to help get people's clothes on. And to me, the biggest thing that's the most important would be having that passion to serve others and knowing that you're coming to work to make a difference in someone's life. And there's a point where the residents they want to see you. And when you have days off and you come back, they'll tell you they miss you. And there's not a lot of jobs where you get that. And I would say just other ones, there's you're going to be taking blood pressures. You're going to be helping people get dressed, helping people eat. You might be helping them in the bathroom, getting cleaned up and such, or giving a bath. And all those things, like I said, you know, having good people skills to me is the most important thing.
And that's what I hear a lot of from all recruiters in all industries. It really just comes down to human skills, interpersonal skills. That's what really everyone looks for first with hiring.
Yeah, it's your heart.
What if the callers, viewers on this call also put a link to Deed's labor market information? Thank you. It's select healthcare and social assistance occupations in demand in the metro area, which includes the salary info. Yes, Deed, Department of Employment and Economic Development, has a fantastic labor market team that is always putting the latest information on the growth of occupations and the salary ranges. And many of or all of the data that a job seeker sees on careerforcemn.com whenever you see labor there, the labor market information, that's pulled directly from the deed site. So you can be sure that either site you're on, you're going to be getting that information.
I think one of the nice things too is working with the Workforce Center, because they can provide job coaches. And we did a lot of work, taking people who are learning job skills and doing it through the Workforce Center, where you can get a work coach, a job coach, and other resources, like maybe even help getting your first set of scrubs and shoes. That's a great thing to have. I refer a lot of people who are looking or just might need a little extra help on getting things going to the Workforce Center. They have some wonderful resources.
Thank you for that plug. Yeah, we think that we have a fantastic staff too. So just know that when Annette says workforce, the career force location, career force center in your area, it's all one big system. So we appreciate all of the fantastic business partners like Jones Harrison that are always supporting us in our work. And it's great to read all of the testimonials from people in the chat here about their experiences, all very positive, which reinforces that this is a human-centered industry. So I want to thank Lynette, Annette, and Valerie for being on the call today, all of your information. And please pass this information along to other friends and family, no matter what their age. If they're looking for a change to be involved in a very heart-centered, human-centered occupation, this is the one that they should consider. So thank you very much, speakers.
Thanks.
Career Force continues with support for all job seekers. Oh yeah, thanks. Coming up this week, there are a couple of more events happening all over the place. Hennepin County is having a virtual hiring event. On Wednesday, they'll have at least 15 employers there on the call. There's an online job club conversation on Thursday, led by a Career Force staff person. There's the south of the river. That means Dakota, Scott County, South Hennepin County, uh, virtual job fair that's happening Thursday morning at 10 as well. And then next month in February, I transition my Explore Career Conversations into getting hired in state government. There are currently 650 open positions, again, also in human services and healthcare, but so many more departments than that, all across the state in all regions for all educational levels. So we're going to spend 3 weeks of having Explore Career Conversations around that, and then culminating at the end of February with a meet and greet of state agency recruiters. So I hope you all tune in and spread the word about that coming up. We have a fantastic statewide public career fair calendar, so you can check whenever there's a hiring event in a company near you. Follow the QR code and get it on your smartphone, mobile device, and bookmark it so you always have that in your fingertips. And as we've said, we've got a fantastic staff that wants to work with you over the phone, online, or where able, in person. So please contact us, or you can call us at 651-259-7500, and we'll be able to connect you with someone in your area. Thanks everyone for being on the call. I appreciate it. Keep sharing the word and help each other get into the healthcare field. Thanks and goodbye.
Thank you. Have a good day.